Hi, good afternoon. My name is Shannon Curvey. I am owner and operator of Function and Fitness, and today I'm going to be presenting on health and wellness as it relates to organic living. All right, so just a little bit of background on me. Function and Fitness is a place where I specialize in bridging the gap from healthcare to fitness through post-rehab personal training and therapeutic massage. In a nutshell, basically what that means is I help people reduce their functional deficits and manage their health conditions through exercise and through massage. How did I get here? Well, long story short, I was working in a couple of physical therapy offices, chiropractic offices, and even have some experience in big box gyms. During that time, I recognized a huge gap in the abilities of fitness levels in the people who left those facilities, namely the healthcare facilities. A lot of people were sent to the gym, but they still had various limitations, which kind of stood in the way of their progress. So they wanted to be able to run, jump, climb, play, and all those things as they did before their injury, but they weren't able to because of lingering deficits in their fitness. Their injury was quote unquote healed according to the healthcare practitioner or insurance company, but they still weren't able to do the things they enjoyed. And so where does one go when that is the case? Now they come to Function and Fitness. So health and wellness. All right. That is a very hot topic, especially now that we are looking for ways to improve our immunity without drugs, as well as, generally stay healthy without synthetic drugs, I should say. So health and wellness. What is a healthy lifestyle? What does it look like? What's a good diet? What's the best fitness routine? These are questions that I get very, very, very often. And I mean, why is it important? These are questions that we have to ask ourselves, and somehow we have to find answers to those questions of why this is so important. So I think the first thing we should do is look at what exactly is health. Like, we have our definitions of health. Health could be, the absence of illness, right? Health could be the ability to run a mile. Health could also be the type of food that you eat, right? So I went to some of our organizations who are experts in this. The World Health Organization defines health as a state of complete physical, mental, and social well-being, not just the absence of disease or infirmity. It is the complete mental, physical, and social well-being. Now, this definition has not been amended since 1948. So for quite some years, this has been the definition by the World Health Organization, a pretty reputable source, if you ask me. So with the absence of complete mental and social well-being, that's a tall order. That's a tall order. How many of you can say, based off of this definition, you are healthy currently? I know I for certain could not. I am striving for health, and I think that's one of the keys here is that health is a journey, not a destination. It is something that we are continually working towards. Wellness, based off of the definition from the National Wellness Institute, says that wellness is an active process through which people become aware of and make choices towards a more successful existence. That sounds a little bit more doable. Wellness is an active process through which people become aware of and make choices towards a more successful existence. So that includes, it sounds like to me, it includes mental health, physical health, intellectual health. How much are you learning on a regular basis? Many areas. And actually, the National Wellness Institute identifies 6 dimensions of wellness. I'm not going to go into that right now. It's not my expertise, but you can look into that, at your leisure. One of the ways that I look to achieve health and wellness, as well as ways that I recommend others achieve health and wellness, is through exercise. Exercise is a great way to, stave off illness, a great way to improve mental clarity. List here, you should be able to see it on your slide. On this image here on the screen is hard to read, but on your handout, you should be able to see that there are 50 different reasons. All right, if you have a hard time coming up with one, these folks have come up with 50 different reasons to exercise. All right, number one on the list, if you can see, is it lifts your mood. All right, so we talk about mental illness or mental health. Exercise is one of the best ways, natural ways, one of the most organic ways that we can boost our mood. Just to name a few others: improving cardiovascular health, reducing anxiety, improve total body strength, boost immune system, control body weight. Again, the list goes on and on and on, and I'm sure that we can find and identify probably 50 other reasons that are not listed on this list here. What I usually get is a couple of questions. Number one, how much exercise should a person do? Great question to answer. That depends on the individual, but I will say blanket statement, when we're talking about maintaining health, you want to strive for at least 30 minutes a day, 5 days a week, okay? 30 minutes, 5 times a week with some rest. Your rest is just as important as your activity. So 5 times a week, 30 minutes each time. If you have specific goals that you would like to achieve, i.e. gain muscle, lose fat, improve flexibility, things of that nature, you would want to add a few more minutes to that. And it depends on your specific routine. Seek out a professional for that prescription. But generally, 30 minutes, 5 times a week is ideal. I also would suggest that you vary the type of activities that you do. Doing the same activity over and over again is one sure way to injure yourself. Repetitive use injuries are a thing, and so you definitely want to do a variety of activities, such as yoga, walking, jogging, weightlifting, swimming, participating in martial arts, Pilates, dancing, etc., etc., etc. Anything that is moving your body, that causes you to breathe heavier than you would in a sedentary position. Anything that puts your body in my advice is anything that puts your body in different positions than what you do on a regular basis. So if you are a person who sits all day, your exercise should not involve you in a seated position, okay? Unless you have some sort of a disability. All right, look to engage in activities that have you standing, that allow your spine to move and bend in all of its anatomical positions. Look for that variety. That is what our bodies need, not the repetitious positions of sitting or being, kind of curled up in a fetal position as you would if you were laying down. All right. Now, exercise for the body is awesome. There are also many, many benefits for the brain. This is one thing that we do not recognize many times, is the wonderful effects that exercise has on the brain. I put this slide in here because it really spoke to me. It really highlighted some things that I was unaware of, and for me, gave me a little bit more motivation to maintain and continue my exercise regimen. Just to highlight a couple of activities that are here, and again, here on your monitor, on your screen, you may not be able to see it clearly, but if you look at your handout, you can see some pretty important activities, as well as the areas that affect your brain. Let's take aerobic activity down here in the corner. Aerobic activity affects your memory. All right, helps to improve your memory. Okay, the part of your brain that deals with memory is also triggered when you do aerobic exercise. So aerobic exercise, things such as jazzercise. I'm dating myself. Things such as Zumba classes, walking, jogging, in your treadmill, if you got a Peloton bike, roller skating, hula hooping, all of those activities are aerobic. All right, anything that increases the exchange of oxygen and carbon dioxide through the lungs. All right, that's your aerobic activity. That is going to help to target the parts of your brain that affect your memory. All right, so I strongly advise you incorporating some aerobic activity if you want to, have a sharp brain. Lifting weights, all right, up here in the opposite corner, lifting weights is a pretty important activity, not only for strong bones and muscle, but also to affected parts of your brain which deal with complex thinking, reasoning, multitasking, and problem solving. So this one kind of made me laugh because I thought about, the stereotypical meatheads, or the jocks, in high school and whatnot, and the stereotype that they were less intelligent or less capable in the classroom because they spent so much time lifting weights. And according to this chart here, that's probably not the case. They probably were very good complex thinkers. I know a few myself that will dispel that myth. Let's also take a look at yoga. Yoga affects the part of the brain that deals with integrating thoughts and emotions. Also deals with fear and anxiety. All right, so just to highlight 3 of the activities that are benefiting very important areas of the brain. And again, this is just with exercise. Okay, I'm not talking about anything other than exercise. So when you compound these types of exercises, lifting weights, yoga, aerobic activity, aerobic exercise, when you compound those with a good healthy diet, positive thinking, other organic methods of maintaining your body, this can make a huge difference and be key to your health as well as your wellness. So exercise on the brain and body. Okay, so we just looked at the brain. We're gonna take a look at the body in just a moment. But exercise has benefits that stretch beyond. A lot of us think that you watch people do burpees and you're like, oh man, you're crazy, or oh man, you got great aerobic capacity if you can do that. And truth of the matter is, that is true. There is some truth to that. However, it goes beyond that. All right, the ability to do a pull up or a chin up, that's great. That's wonderful. But deeper than that, exercise is a healing activity. All right, it provides stress relief, increased energy levels, increased mobility. That's all types of exercise, not one specific exercise as a whole. It's medicine. All right, exercise is medicine. Exercise is the best antidepressant you could ever use. Exercise is the best anti-inflammatory drug that drug that you can use. Exercise is what keeps us moving. Move it or lose it, right? The best way to keep going is to do that. Just keep going. And unfortunately, as we age, there are things that happen. Osteoarthritis is one of them. And osteoarthritis is inflammation of the joint or the wearing down of a joint. As you can see, one knee, this is a knee joint, okay? Diagram here or a x-ray view of a knee. And this knee is, brand new on one side and a little deteriorated here on the other. This would actually be a right knee that we're looking at. The deteriorated knee is an organic knee. If you live long enough, this could be your knee. All right. There's no foul play here. This is just what happens when you live long enough, right? The degree of it varies from individual to individual. However, osteoarthritis can and will happen. If not the knee, you may get it in some other joint in your body. Okay. But one of the best things that you can do is continue to exercise. Strength training in particular is one of the number one methods to improving your joint stability as well as joint function. Joint function. All right. Strength training at minimum twice a week is been known scientifically to improve the health of a joint. Cardiovascular activity also helps to increase blood flow around the joint, bringing fresh nutrients in, flushing out excess fluid. A lot of times when you have a knee that is arthritic, you will retain fluid on that knee as well. And through that fluid retention, you get stiffness, sometimes some pain. So exercising it helps to move the fluid out so that you have better mobility. Some deterioration is normal. Like I said, we are organic beings. Our bodies are designed to deteriorate or decompose over time. That is a normal occurrence. If you are trying to stop that process, your body will resist because that is not natural. That is not the organic way that we're designed. And with osteoarthritis, an anti-inflammatory diet can be helpful as well. Again, the things that we put into our body highly affect the way that our bodies respond and behave. All right, so our muscles. This lady has obviously become very acquainted with this weight room. She looks great. I don't know how old she is, but I'm just guessing by the gray hair that she's not 18. She could be, I don't know. But she looks great, and in my opinion, I would attribute that to her exercise regimen. Obviously she lifts weights, yes. We can assume that she does some cardiovascular activity. We can assume that she also does a bit of stretching, maybe not in the form of yoga, but there is some sort of a stretching regimen that she probably does as well. But exercise and weight training specifically, great to strengthen the bones as the muscles and the tendons become stronger. The body as a whole, becomes stronger. High repetition weight training and cardiovascular activity can help to build muscular endurance. Muscular endurance is the ability to maintain an activity, for a long period of time. How long can you walk? How long can you run? How many stairs can you climb before you get tired? How many push-ups can you do? How many squats can you do? The beautiful thing about our bodies is that they adapt. Our body will adapt to any environment that you place it in. All right. So environment or environment meaning under resistance, if you're doing push-ups, and today you can only muster 3 push-ups. If you keep working at it, soon your body will adapt and recruit more muscle fibers so that you can now do 5 push-ups. Once you achieve that, your body will now decide, hey, this person needs more muscle fibers. They're trying to do 10 push-ups. So let's recruit more muscle fibers to do more push-ups. And once you've recruited a sufficient amount of muscle fibers, you will begin to grow more muscle in general and become more toned. All right. And then you start to look a little different and feel a little different. And that's just from your body's natural process of adapting to activity. All right. After injury, exercise is super duper important because it helps, again, to build strength and endurance. Also allows you to regain function in the area that was injured. All right. Having strong functional muscles is thought to be the secret to the fountain of youth. All right. I believe that to be true. As we use our muscles, we must also allow our muscles to recover. All right. A recovery plan is very important. And massage is one of the great things that we can do for our body, right? On the bottom of this slide, massage is good medicine. Exercise is good medicine. Massage is good medicine. All of these things. The funny thing is, you notice there are 25 reasons to get a massage. All right. A few slides previous, we had 50 reasons to exercise. What's up with that? So I think we have to list more reasons, give people more reasons to exercise. And apparently people need fewer reasons to get a massage. If you're like me, I'll get a massage just because it's Wednesday. There is no particular reason. Massage feels good to me. It's stress relief for me. It's pain management for me. It helps to improve my mobility. But again, in this list of reasons why, of them is stress relief. Yes. Of them is to reduce muscle tension. Yes. Also lower blood pressure. All right. When we talk about managing health conditions, also helps to decrease rheumatoid arthritis pain, osteoarthritis pain as well, and also can affect migraines and reducing the frequency of a migraine. So if you are a migraine sufferer, you may want to consider having a massage on a regular basis. All right. The list goes on and on. Take a look at that list at your leisure. And again, there are many reasons why we should have a massage. One of the things, as a massage therapist myself, one of the things that I get asked regularly is, when or how often should I have a massage? How often is a massage recommended? And on a maintenance level, just to say, if you just want to, keep things flowing smoothly, manage that migraine frequency, if you are looking to manage your rheumatoid arthritis pain, so on and so forth, every 4 to 6 weeks is a good idea. Every 4 to 6 weeks, just to work out the kinks, just to keep things from building up. Now, if you are in crisis or if you have some kind of a chronic condition, you would want to have an appointment more frequently, maybe once every week or two. Personally, I'm a person who works out 4 to 5 days a week. I like to have a massage twice a month. Generally, every 2 weeks, I am having my body relaxed and having the tension released from my muscles, because I am pretty active, as well as just maintenance from my everyday job, from working on my feet and doing massage on a regular basis. Now, another question I have answered frequently is, what type of massage should I get? Say, hey Shannon, I went to the spa, I looked at the spa menu, and there were 10 different types of massage. I don't know, I didn't know what to choose. What do you suggest? Well, first thing I would suggest is talking with your massage therapist prior to your appointment. If you have the ability to talk to whoever's scheduling, you can tell them a little bit about what's going on with you, and they may be able to recommend a massage treatment for you. But just to give you a little inside information, the difference, one of the differences, with Swedish and deep tissue, a lot of people get these mixed up. Swedish is smooth and relaxing strokes. All right. It's almost like just kind of, rubbing oil on you, just kind of smoothing away the worries of the world. That is your Swedish. Your deep tissue says just that. It goes a little bit deeper into the lower levels of your tissues. It works out those knots and adhesions, which are muscles that kind of stick together, muscle fibers rather, that stick together, and can be a little less relaxing depending on your pain tolerance, of course, but very effective. Can sometimes leave you a little sore the next day, but generally by 24 hours you are good to go. Sports massage is another option. This one I would highly recommend for those that are extreme athletes, that do marathons or ultra marathons, triathlons, things of that nature, sports massage would be a great idea. And there are techniques that are used before and after your event. And then there's also myofascial release. All right, myofascial release is defined as a gentle, sustained pressure applied to the myofascial connective tissue to eliminate pain and improve function. So that as well is something that you probably would see more often in a medical setting or orthopedic setting for massage. Something like my practice, I tend to do a lot of myofascial release with my clients. Craniosacral, hot stone, chair massage. These are all different types of massage that can be received. All right. If you have any further questions on that, feel free to reach out to me and we can discuss at a later date. Me personally, in my practice, I do not practice any one of these treatments. I usually incorporate a combination of all. My treatments are very much tailored to the individual, your need, your condition, the things that we set goals for prior to your appointment. So one day may be more of a deep tissue, other may be some sort of a myofascial release, where I also incorporate some other massage tools to help to alleviate your dysfunction. So when we're talking about organics, there's nothing more organic than a massage, manually affecting the muscle tissues from one person's hands to your muscles. Our bodies respond to touch. We are humans. We thrive on human connection. We thrive on the ability to connect with one another. So massage in and of itself is a great way to heal, whether it be a mental or a physical injury. Please consider massage for that. Another way to heal yourself is to put good food into your body. I'm not going to talk too much on this because we have other specialists for that. But just know that food can be the best medicine or the slowest form of poison. All right. As I noted before, exercise is medicine. Food is medicine. I also say motion is lotion. All right. All of those things you want to incorporate. When we're talking about being healthy and ridding our body of infirmity and disease, nutrition is one place to start, probably the first place to start. Then comes exercise, all right, and then comes massage with improving circulation, breath, and all of those things, all right. That brings us to a close, all right. I hope that you have pulled out a couple of nuggets from what we've discussed here. Living a healthy and well-balanced life requires a consistent effort and a commitment to the journey. It is just that, a journey, okay? If you don't remember anything else, health and wellness is not a destination. It is a journey. You have to continue to strive to complete that journey. As you do that, that journey should include a variety of activities. All right. Massage, exercise, balanced nutrition. All right. All of these things play a huge, huge, huge factor in our bodies and how they look and how they feel. So again, thank you for your participation. My name is Shannon Curvey. You can find me at Function and Fitness in Leesburg, Virginia. If you are on social media, find me on Facebook and Instagram. I also have a page on YouTube that you can check out and follow me there. Keep up with me there. All right. I hope you've enjoyed this presentation. It's been a pleasure sharing with you. Have a great day.